Welcome to this presentation on Hospital Readmission Reduction Program, or HRRP. My name is Hayat Zouak. As a performance improvement professional, I'm excited to share key insight about this important Medicare value-based purchasing program. HRRP plays a crucial role in improving hospital care by reducing avoidable readmission, ultimately enhancing patient outcomes and controlling healthcare costs. This overview is tailored for allied health professionals, focusing on how this program impacts your work and patient care. Here are the learning objectives for today's session. By the end, you will be able to clearly explain the goal and purpose of HRRP, identify specific clinical measure involved, describe how at least one critical metric is calculated, understand hospital reporting requirements, summarize the incentive and penalties tied to hospital performance, and discuss how HRRP has influenced healthcare quality improvement nationally. This objective will prepare you to better engage in quality improvement effort in your healthcare setting. HRRP was designed to reduce unnecessary hospital readmission within 30 days of discharge. It encourages hospitals to improve care coordination and discharge planning processes, ensuring patients leave the hospital fully prepared for ongoing care. Importantly, HRRP links Medicare hospital payment directly to readmission rate, meaning hospitals face financial consequences if they have more readmission than expected. This program exemplifies how value-based purchasing shifts our focus from volume to quality. The program focuses on 6 conditions and procedures associated with higher admission risk: acute myocardial infarction, heart failure, chronic obstructive pulmonary disease, pneumonia, coronary artery bypass grafts, CABG surgery, elective primary total hip or knee arthroplasty. These conditions were selected due to their frequency and the opportunity hospitals have to influence the admission rate through better care transition and patient education. Let's take a simple example of how hospital readmission performance is measured using the excess readmission ratio, or ERR. Hospital B has a predicted readmission rate for pneumonia patients of 10%, while the national expected rate is 8%. To calculate the ERR, we divide the predicted rate by the expected rate, given 1.25. A ratio above 1 means more readmission than expected. Hospital B's 25% excess readmission would put it at risk for payment penalties. These metrics help CMS determine which hospital needs improvement and encourage proactive care management. Hospitals are required to submit their admission data yearly to the Center for Medicare and Medicaid Services, or CMS. To be evaluated on specific conditions, hospital must have at least 25 eligible cases. Each year, CMS provides a review and correction period for hospital to verify their data before final results and penalty determinations. CMS also publicly report this data to promote transparency and accountability, enabling patient and provider to make informed decisions. Unlike some programs that offer bonuses for high performance, HRRP is penalty only. Hospitals with higher than expected readmission rate face reduction in Medicare payment for inpatient services across all diagnoses. These penalties average about 0.22% of the hospital's total Medicare inpatient payment, providing a strong financial incentive to reduce readmission. Avoiding penalties through improved care coordination and patient engaged is a key goal for hospital and healthcare team. Since its inception, HRRP has contributed to a significant decline in 30-day readmission rate nationally, with Medicare saving over $1.5 billion annually due to fewer avoidable readmissions. Research shows that this reduction has not led to increased mortality, suggesting quality improvement without compromising patient safety. However, there is ongoing discussion about this program impact on hospital caring for vulnerable population, underscoring the need for equitable quality improvement strategies. In conclusion, you now have a clear understanding of how HRRP works to reduce hospital readmission, the specific performance measures and reporting processes involved, and how financial incentives drive quality improvement. As allied health professional and PI practitioner, your role is in supporting discharge planning, care coordination, and patient education is vital to the success of programs like HRRP and to enhancing healthcare quality nationwide. So these are the sources. I encourage you to explore these materials further to deepen your understanding and support your ongoing quality improvement effort. Thank you.